And this is like this is a 13-week opportunity that's an immersive experience. So if
Ooh.
your culture is on point and your people are supporting each other, what a better marketing could there be than an immersive experience to want to go back to?
Welcome back to Tell Me Why, a podcast about and for the healthcare workforce, brought to you by the South Carolina Hospital Association. I'm your host, Emily O'Sullivan, and I'm joined by my co-host, Jen Wright. And today we are thrilled to welcome our guest, Mindy Milligan. She's the Regional Vice President of Program Management for Qualivis, which is an endorsed partner of Solvent Networks, which is a division of SCHA, and they provide sustainable workforce solutions. So we invited Mindy here today to discuss a crucial and sometimes misunderstood topic, which is the role of contingent labor in a modern healthcare workforce. So we'll be busting some myths today, exploring new trends, and talking about how a flexible staffing model is more important than ever. So Mindy, welcome to the podcast, and thank you so much for being here.
Thanks for having me.
So, like Emily said, Mindy, I think we met at the Workforce Roundtable maybe last year and really had some great conversation around this topic. So, we really have been looking forward to kind of drilling down on some of these ideas with you. But before we dive too deep into it, we like to ask our guests to share their why. So, what are some of the personal and professional paths you've taken that have drawn you to this work?
That's such a big question. I could spend a whole episode talking about it. I would say my drive, my main reason why is because I've always wanted to help people. Even though I fell into this career very accidentally on my way to being a child and family therapist, that was my original plan. Once I realized the impact that I could have doing this work, once I realized how much reach I could have as one person helping all these different health systems, it fueled me a lot to carry on and find different ways to learn more about the industry and ultimately to get me where I am now, supporting Qualivis and making sure that we advocate for all of our clients and facilities that we work with. So that would be my main why.
Fantastic. So, now let's kind of get into this contingent labor, travel nurses. Sometimes they have some negative preconceived notions. So, share with us some of those common myths and misconceptions that you encounter about this workforce, maybe particularly about quality and care or commitment.
Absolutely. So, a lot of people, when they hear contingent labor or when they hear travel nurses or travel industry, they think of us as the necessary evil. And by that, I mean, they have shortages, they need people. And so they feel forced almost to use services like that to bring in that additional help. There's a lot of folks who may also look at the quality aspect and think, oh, well, travel nurses, they don't really have that much experience or they don't really have skill. They don't stay anywhere long enough to get skill. And it's actually quite the opposite. A lot of travelers get into this industry because they want to expand their skill set. If you think about it as if you only ever ate at one restaurant, you'd only ever know that menu. But if you go and you try food all over town, you'll have more of an eclectic understanding of what's out there and opportunities that are available to you. So travelers often use contingent labor working, so these travel contracts, to get more experience, to see how other health systems are doing. And most importantly, they do this for a limited time for the most part, and they'll find their way to a new home, a new place that they like better, whether it's a new location that they like better, or maybe it's a culture that they're seeking. But a lot of those things are like the driving factors behind why they do this. The other part, in terms of that necessary evil, I think the industry has gotten a really strong reputation for greed, for a lot of the underbelly, if you will, of the staffing side of things. And there are actually a lot of hospitals that could tell you that we're actually a partner. We're not just a vendor. And there are some agencies out there that do operate very transactionally, and that's all they want is to do that transaction. But there's also a handful of very good agencies that want to be a partner. They want to actually serve the purpose of aligning strategically with goals that hospitals have. And for those people, I would say they get to experience the positive side of our industry.
I love that. That's such a great shift in perspective for folks. So, Mindy, one of the things that we have started asking a lot of our guests is about new technology. The healthcare industry and really every industry right now is kind of buzzing about AI specifically. And so, we've heard a little bit about AI powered predictive scheduling. So I was wondering if you could talk a little bit about how you're seeing this technology change the game in terms of managing a flexible workforce. How does Qualivis use it with their clients, and how can it potentially benefit both the organization and also the employee?
Absolutely. So you're absolutely right. You hit it nail on the head. Technology is the buzz of the day, all sorts of things. So specifically AI predictive scheduling, the idea behind that is that it's going to make it easier for healthcare systems to staff to the true curve of their needs. What the system does is it takes in a ton of data from the hospital and it looks even as close as hourly at the census, the beds, all the things that are shifting. And it gives that capability for the hospital to staff more closely to that bell curve, where a lot of hospitals currently go for a 12-hour shift, 7A to 7P. Well, maybe by looking at this predictive model, they see that they can have a huge impact on the functioning and the coverage if they would just shift a couple of hours ahead or behind to meet the actual demands and the needs of the department that they're looking at. So it's very exciting stuff. I think some people are scared of it. Like with any
Hmm.
technology, there's a lot to learn. A lot of people are waiting to kind of see some of the big adopters and see how it works for them before they want to really get into it. But there's a lot of other things, not just the predictive AI. There's also things like workforce assessments and things where you can utilize your data to look at other opportunities to save money, to align on budget, and maybe to shift some of your scheduling habits, maybe your IRP, I'm sorry, use of those, all my acronyms, resource pool, float pools, things like that, to understand the best way to get staff where you need them deployed in the times and the spaces that you need. So there's a lot of things to look at. So I wouldn't suggest, focusing only on the big AI bucket, but also more granularly on the smaller things that can really help some of the facilities now.
That makes a lot of sense, Mindy, and I think that fits really nicely into kind of the way that why is structured around looking at the big picture, but identifying actionable strategies that address kind of those priority pain points. And one of the things that we've talked about on the pod before and shared some of the data that Y has collected, and there's a big interest in staff having flexibility as a piece of autonomy, but also how it plays into that work-life harmony piece. And it seems like whether you're looking at the contingent labor or the travel nursing, or you're looking at scheduling opportunities, it really kind of gets back to what do we need to know about workforce needs and that alignment with patient care that you described. And so when we look at this picture, we kind of look at it in that building resilience and sustainable workforces. And we know that it's not a one size fits all approach. So, what does a truly diversified staffing solution look like for a health system today, in your view? And maybe what advice would you give on choosing the right partner for this, and any red flags that folks should look out for?
Yeah, that's a great couple of questions. In terms of the diversification, that's a part that actually I get very excited about because every hospital is different. Every system is different. It is not, you nailed it. It is not a one size fits all. For instance, and Qualivis does a lot of different things in terms of we have a lot of different technologies, we have a lot of different people solutions. Whether you're using Qualivis or not, the important piece is to look at what you actually need and how you can be as flexible with those needs as possible. So, for instance, I was talking with somebody this morning about the difference between travel nursing and allied and per diem opportunities. Well, when you're locked into a travel contract, that's for 3 months. And then when you layer in something like per diem, which is daily staffing, you can do that in bulk or you can do it like as the need comes up. If you put those two things together, you've locked yourself into a situation where you don't have to have a full-time person. You can layer in the flexibility of the per diem piece to have more maneuverability to cover your needs. And then you start looking at the other solutions that maybe aren't that at all. Maybe it's perm hire. We have a product called Core Hire. It's where we post jobs for permanent staff. We also have that for like Doc Cafe. I could go on the whole menu of things that we offer, but my point is when you diversify your strategy, you can actually plug and play where you need it when you need it. And so the important part about that when you're choosing a partner, Qualivis or any other, is to make sure that you're sitting at the table with your partner, you're talking with them about what your strategic goals are and making sure that they can align with that. If someone comes in and says that they have a magic beanstalk of clinicians that's just waiting to come fill all your needs, that's not true. There's no magic beanstalk. I would be very aware. I love salespeople. Some of the greatest people I know are salespeople, but they are salespeople. They're going to come in and tell you what you want to hear. So if something sounds too good to be true, trust that it probably is. Ask lots of questions. This is extremely important. What these hospital systems are doing is supporting our communities. The community we live in, where our families go to get care, you want to make sure that the person coming in the door has the right mindset and is ready to partner with you in a way to support that community. So when somebody comes in and says, I can fill all your needs in 5 minutes, I can do it for a lower price, some of those things may be partially true, but ask all the questions. Always dig in. And then most importantly, I think I've said the word diversify at least 6 times, but if you look at your needs and you're thinking through, this is so much, I feel like maybe I'm never going to get out of the traveler game. A good partner is going to help you understand that travelers can be useful forever. You can have a budgetary line item for them. They were never intended to be an easy button. They were never intended to be a huge strain on the budget, a giant conversation that everybody wants to avoid at the time of budget talks. They were always intended to be a flexible option to help you when you need them and to be not there when you don't. So everything you do should kind of align with that same type of strategy. And I'm happy to talk more about that anytime with anyone, whether they're my client or not. I really don't mind answering questions, even if it's just to help you make a decision with something that has nothing to do with Qualitas. Just know that.
I love that answer. And it really ties into my next question, which has to do with, the workforce shortages, we've seen in the healthcare industry over the past several years. And hospitals are more focused than ever on building a strong and loyal team and trying to figure out, how can we get people in the doors and how can we get them to stay. We often see contingent staff and travelers move on, but there's also a huge opportunity there for hospitals. And something that they often overlook is, having a great culture and creating a great experience for those travelers so that they will want to stay. So, are you doing any work to create pathways for converting those talented individuals from travelers to permanent full-time employees? And if so, what are some of the benefits you've seen from those conversion opportunities?
Yes, is the simple answer to that. So there's a lot that we're doing. I'm actually really proud of that. That's one of the aspects of Qualitas that's very different from what some other folks. We don't hold back when it comes to conversions. There's no conversion fees after any traveler completes a 13-week assignment for clinical, and then for non-clinical, it's a little bit longer because those are typically a little bit different. But regardless, the transition period is something that we like to talk about from day one. So whenever they come in and they're identified as a great match to the facility unit department, we actually talk with managers, with marketing, with all kinds of people within the health system to talk about a multifaceted approach to getting them to consider coming on full time. I mentioned earlier that travelers get into this industry because they want to see a lot of things, but they might be looking for another home. And that's where the conversation starts. Usually when I talk with people about conversions, a big piece of this is consistency in messaging, letting people know how they can be a part of your internal culture, but also the community at large that they're serving at that moment and in that contract. But then also the consistency of, it's okay if they tell you no the first time. Stay in touch with them. Because on average, most travelers only do about 7 or 8 assignments before they want to settle down, whether temporarily or for a long period of time. And so that is an opportunity for you to continue to stay in contact with someone and get them to stay. The other really important thing that we like to talk with healthcare systems about is we're not just wanting people to look at this as a one and done in terms of a traveler coming on board. It's actually a marketing investment. You've already spent the money to get in front of this person and to have them into your organization, like a try before you buy type of situation. You should use that investment as basically a recruitment opportunity. You have them
Absolutely.
however long, 13 weeks, 2 months, whatever it is. And you can use that as a recruitment opportunity. But also don't forget that you're trying to make sure that your own staff doesn't feel that they're more important. So you don't want to come at it as a, can we do to get the travelers? You want to come at it as a, let us let you be part of our community. Let us bring you into our family. And then your appreciation for your existing staff doesn't get overlooked at the same time. Because if you do those two things in tandem together, then you don't set it off balance and cause a mass exodus of people who think you don't appreciate them, because you never want to do that either.
Yeah, that's such a great point. You don't want to create resentment among your loyal employees. So
Exactly.
you have to look at both groups and create an environment where everybody feels welcome and valued. So great point.
Absolutely. And we do support those efforts. We have a lot of reporting that we can give our clients in terms of how to get in touch with travelers if they want to do marketing campaigns while they're working or even after they've left for a period of time. We do support all of those things as well, just to stay fresh and top of mind with those folks.
It just makes me think of, when we think about culture, we talk about it's what you experience. It's the way things get done. It's the way we treat each other. And that is the ultimate recruitment experience. It always makes me think of, I'm a sports person, so I kind of equate it like if you're an athletic recruit and you go to the school that wants you to work there, that's what they do. They try to envelop you in what life could be like if you choose them and all the benefits of that. And this is this is a 13-week opportunity that's an immersive experience. So if your culture is on point and your people are supporting each other, what a better marketing could there be than an immersive experience to want to go back to? So we've talked a lot about kind of the external piece of partnering for staffing solutions, but we're wanting to know if you could lend a perspective to what could be happening inside the organization, kind of looking at that maybe an internal agency model of diversified float pools. And how would that approach benefit a health system's flexibility to meet the desires of their employees?
I think so. This is another one of those really good examples of one size doesn't necessarily fit all. I have seen some programs like this that have been wildly successful, and I've seen others that didn't do as well. I would say when you have a system that's capable of giving a similar experience to the travel industry, meaning they have multiple locations and maybe they can have a system-wide float pool approach, that can be exciting for the same reasons I mentioned earlier, having opportunities to see how different units do things, how different campuses do things. It can also come with the benefit of not being boring, right? Some people like me love for when your day to day is not the same. I like to do different things every day. And so usually that fills a void that people didn't even realize that they needed. Where it doesn't always come in to be successful is some folks look at the float pool opportunity or the internal agency, it can be called all kinds of things, and they think just throwing money at it is the answer. I would strongly suggest not doing that. Because money is not the only motivator that gets people going in the morning. And while you do want to pay a premium dollar when you're asking people to drive all over, a health system, premium dollars is one thing, but going overboard, I've seen some places where they were trying to keep up with like a traveler pay. That's just not sustainable. And I wouldn't recommend it. I would say that the best thing you can do to make something like that work in your favor is to consider the suite of other things that you have to offer, like your culture, like your educational benefits, like, maybe there's a student loan forgiveness programs, or there's things like that you can layer into these opportunities. And then also the diversity of being able to work at different places, different units, and maybe self-scheduling, because that's a big piece that's a satisfier for a lot of people.
Mm-hmm.
So I would just try to avoid thinking that everything is about the money. It's definitely not.
It's a really
Such a great point. So, Mindy, given everything that we've discussed today, from dispelling myths about contingent labor to embracing new technology, what's one piece of advice that you would offer to healthcare leaders that are looking to successfully integrate and leverage contingent labor as a part of their long-term staffing strategy?
Other than call me, I'm going to say, honestly, I think it really comes to be willing to talk with the other members of your organization. When you have silos where, let's say, HR and nursing and finance are not cohesive, they're not talking to one another, you end up in situations where people talk you into things that may not be in your best interest. So my honest opinion in this is whoever you're talking to, have what I call the trifecta. Have your HR people, your nursing leaders, and your finance all in the same room talking about these things, understanding there's different urgency levels. There's levers that you can pull internally to make sure that you're not spending a bunch of money on overtime or going without and causing high turnover in your own staff. These are things that happen a lot because decisions get made in silos. So if you can avoid the silo approach and have this more collaborative communication, and then of course collaborate also with your external partners like Qualivis or whatever MSP or agency you may be using, that can help you to find a better way to align and reach your goals. Trying to fight against one another is never the way. So that's the piece of advice that I would give for whatever that's worth.
Yeah, that's great advice for any situation, really. So, as we wrap up today's episode, are there any questions we didn't ask you that you wish we would have? Or do you have any final thoughts that you want to leave our audience with?
I could, like I said, I could talk about this stuff all day. I love what I do. It gets me very excited. I hope that maybe if you get some feedback, I could come back and answer more questions for some people. I'd be happy to do that.
We'd love to.
But overall, thank you. Overall, I think, we covered a lot of stuff today. The biggest piece that I would like to leave behind is just that, it doesn't have to be taboo. It doesn't have to be, we're not the big bad wolf. I mean, there are some agencies that operate that way, but if you ask your questions and you advocate for yourself and you find somebody that really wants to be a partner with you, this doesn't have to be a scary journey. This is something that you can do with help. And that's the point of why we do what we do. So at the end of the day, again, I would offer, I'm here to talk to anybody that wants to talk about it. And I'm happy to answer any questions that anybody has.
And on that note, how can people find out more about you or get in touch with you?
You can email me at mmilligan@qualivis.com. You can call me on my phone. You can send a carrier pigeon. It might just find me. Any way is fine. You can go to the website or you can email me and I'd be happy to chat with anyone.
Great. Thank you.
That's great. We love your permission to put that contact information in our episode description. That'll make it easy for our listeners. Well, Mindy, you have been so gracious with your time, so generous with your offer to be that listening ear and that, insider to help people understand the kinds of decisions that they're making and really look at it as a long-term strategy. So thank you for telling us why, for sharing your invaluable insights. Some of the key takeaways for me that I feel like are really those vital contributors to not only culture, but just the success of using this as a really great resource is that collaboration piece. I love that you stressed that as your kind of final thought of don't do it in a silo. All the folks that this is going to touch, make sure they're part of the conversation. Also, the flexibility that this reframe of contingent labor and how they fit into that larger picture is so important. And then having that people first mindset. So it isn't just about the labor you're bringing in, but it's how does that fit into all of the other people they're working around and people they may touch. And then lastly, just understanding that healthcare and the workforce is the future dynamic really requires us to have a diversified approach to staffing. We have really appreciated the enlightening pieces of information you've given us. And with that, just another thank you. And we would look forward to another conversation like you offered. To our audience, thanks for listening. To learn more about the Y Initiative, as always, you can visit scy.org. And if you enjoyed the episode, please leave a review, share the podcast with your friends and colleagues, and certainly follow the show so you never miss an episode. Thanks so much for listening.